Thank you. And I want to just express my appreciation to all of you shelter staff who go out of your way not only to attend a presentation like this, but just for the work you do. This, I'm not telling you anything. This is so hard. I've spent time in shelters. I did a research project on shelter dogs. I have volunteered. I've done the spaying and the neutering, and but the on the ground work that you do, doing your best to try to understand who these pets are, to try to find ways to get them into forever homes, because one of the saddest things, aside from euthanasia, is seeing them come back in because they didn't work out. And we know that when that's happened 2 or 3 times, their chances of getting that forever home diminish. And as much as this is about noise phobia, storms in particular, we're going to also talk about how this relates to other behavior problems and how you, when you maybe ask questions or use a questionnaire to screen the pets as they come in, you can start to understand more about these. Because the good news is that if you are armed with knowledge, these pets, almost all of them can be helped and they can work out. So that's that's the gist of this little meeting. So let's talk a little bit about noise reactivity. There's a gradient here. It's not an all or nothing thing. There are some dogs who start out just jumping a little bit when they hear a loud noise. Um, and people will often tell you that because they don't believe that that will disqualify the dog from getting adopted from another home. So it's a valuable question. And so if they maybe jump a little bit, or if they, at the other end of the scale, they tremble and they salivate and they hide, and they might even cry. I mean, you see the whole spectrum here. And we want to identify these things, needless to say, as early as possible because, like most problems, whether it's a problem in the brain, which of course that's where the behaviors are, or a problem in the joints or the liver or the heart or any other part of the body, early treatment, early diagnosis and early treatment can make a very big difference. And the thing with neurologic disorders, and that's what behavior disorders are. We have problems with the circuitry and the neurotransmitters in the brain. And in fact, we'll talk in a minute about how that whole thing starts. But we know that when we repeat, we provide the same stimulus to the pet, in this case, loud noises from, thunderstorms or fireworks, and the dog reacts. Well, this sends a cascade of events through the neural circuits in the brain. And with modern brain imaging nowadays, fMRIs, and PET scans, we can actually measure the width of neural circuits and the strength of the synapses and the increased numbers of inhibitory and excitatory neural inputs that sharpen and speed the response. Well, the brain is called a plastic organ, meaning that it can change permanently. And the old saying, practice makes perfect. Well, if we rehearse these ramp ups in fear and panic with dogs who have storm phobia, they just get worse. Or if you want to put it differently, having practiced it so many times, they get better at it. And we need to interrupt this cycle early as possible. So a phobia is sort of the end stage on this thing. And the response, of course, is way out of proportion to the actual threat because most of these pets have never really been struck by lightning and most of them never will. So it's not really logical. But it's a problem that affects up to half of pet dogs. So it's certainly worth asking about. So genetics, they play a big part. Herding breeds are overrepresented. That outstanding looking border collie in front of that cholla cactus here just outside Albuquerque here. She's very dear to me. She's my dog. Her name is Miss America because she's so cute and perky. And she has a storm phobia and a thunder and a noise phobia, fireworks as well. And it started out pretty minor when she was a young dog, and I've been treating it, and we've actually reduced the her symptoms. And she looks forward to getting treated, and we have her all set up and we're ready. So you can make a difference in the well-being of these pets. And so you can see the range of symptoms here, and you've probably all seen this kind of stuff before. Um, but that hypervigilance, that's the kind of thing that you can mention to pet parents, is those pets who, they can pick up the changes in the ionic composition of the air as the thunderclouds are coming close to each other, the humidity change. They recognize that stuff before we do. and they start getting anxious. They know what's going to happen. And the hypervigilance, they'll start to pace, they'll start to scan, look back and forth. They're waiting for this problem to develop. And it's early in each of these events that people can make a difference. This dog here is just a brief video, and this is the typical kind of thing that we notice. This dog was pretty bad. You can hear that lip smacking. That's a real serious sign of anxiety. This dog belonged to a friend of mine, and you see this little outfit that the dog is wearing. He had two daughters, and one of them outgrew her one-piece bathing suit, and he modified it so it was sort of like a compression wrap. And most of us have heard of thunder shirts. Thank you. These things, many people hope that that's the one thing they can add that'll make all the difference. Well, the truth is that when we manage these things, we're going to integrate a variety of different methods to help the dog with avoidance, to reduce its fear, to derail its ramp ups, to give it a new, different response and work for its person. And so when people say, well, I've tried everything, I've tried a thunder shirt, and I've tried, pheromones, and I've tried some other medication, and darn it, nothing works. What they're hoping is that there's going to be one solution, and that's going to make this whole thing go away. And it's incumbent upon any of us, people like you folks and myself, and I'm a practicing veterinary behaviorist, we have to make it clear to people what their expectations realistically ought to be, which is, you know, we've got to integrate a lot of stuff. We've got to really work on this and custom fit our management to the individual. And that's how we make them improve. And yes, some of these things make a difference. And we'll talk in a little while about just how effective things like thunder shirts are and other methods, because we have statistical studies, lots of research behind this. This slide here actually was made for separation anxiety dogs, but it gives you a concept of the interrelation, what we call behavioral comorbidities. These are problems that coexist in many cases, not all of them. You can see that separation anxiety and storm phobia, well, about 25% of separation anxiety cases are also storm phobic, but fireworks, which is another noise phobia, very similar. You'll see the figures are similar, and you'll see some other issues. So if you get a pet into this shelter and the primary complaint is that the pet's been damaging stuff when left home alone or barking, and the neighbors can't, the landlord threw them out or threatened to if they didn't get rid of their dog. These are tragic situations because you can help those pets too. Well, some of them are going to have storm phobia as well, and you sometimes find out about the comorbidity, the other behavior, and then you can back into understanding the other ones that are sometimes even more problematic, like destructive behavior when left alone. So one of the most important things that we do is avoidance. You remember who Will Rogers is, this great American folk person and singer and actor back from the 30s. And something that he said that sticks in my mind and I pass on to my clients is that when you find yourself in a hole, the first thing to do is to stop digging, right? Well, we've got a pet whose reactions to this fear stimulus continue to worsen every single time the poor dog encounters these things. Well, for heaven's sake, let's put an end to the worsening. Let's stop digging. So avoidance really matters a great deal. Now, the first thing is these mutt muffs, and if you look at this picture of this Sheltie, people sometimes laugh and say, well, that's funny. No, that's not funny. This is a very well-made product, and it's got a little strap that you can't see that goes below the dog's chin. They come in different sizes, and they fit very nicely. I have never met a dog who didn't accept them quite readily. And of course, people can teach the dog when it's not a storm. At other times that, if you come for this treat and here are the mutt muffs close by, and we do that multiple times, only a few minutes, only twice a day, because you can overtrain. And we've got other research to indicate that that slows learning. 2 sessions, 3 to 4 minutes each. And you teach dogs that, by golly, they get this great snack, and then, they're pushing their head into this thing, and they wear it, and they're happy, in part because they learn very quickly that it really muffles the sound, and they feel better. And people whose dogs have worn these during storms, they say that the dog comes to them to get this thing put on. And the same is true with the thunder cap in the lower picture on this golden retriever. These are very comfortable, come in different sizes, pretty inexpensive. Get them online, of course, and they reduce the dog's ability to see in the distance. So they're pretty handy sometimes for dogs who are reactive to other dogs on leash walks, dogs who are reactive to stuff they see outside of the moving car. But it can be pretty helpful for this. Again, it's not the only solution. But if we can diminish the dog's ability to hear the thunderclaps and to see the lightning flashes, well, that just makes it easier for the dog to succeed. Not the only solution, but it can help set them up for a reduced reaction. So, controlling the sound, some of these old-fashioned fans, we nowadays have the tower fans that are very quiet. But if you're anywhere near as old as I am, you've probably been maybe out in the garage or the shed. You still have one of these old fans that was in a sheet metal frame, and it sounded like an old-fashioned propeller plane taking off. They make a lot of racket. Well, you want that because those are pretty darn helpful at diminishing the intensity of the sound. Now, here's some music called Through a Dog's Ear, which has been scientifically developed to synchronize with the natural rhythm of alpha waves in the dog's brain, and in fact promotes more of that. And this is a calming neurologic feature that goes on, and we want more of that. So Through a Dog's Ear, by the way, is rather pleasant sounding classical type music, so no person will object to it. And you can download it, or you can get the CD and play it on the stereo. And this stuff can not only help drown out the noise, and sometimes people will use that with the noisy fan or the white noise, or instead of Through a Dog's Ear noise, but classical music they can play, relatively quiet stuff, not the Beethoven that'll, rattle the windows. But these things, they can make a difference. And, trial and error matters. I can't ever give people an exact formula. Do these things for every case. Custom fitting these things, but people can be made aware of these and that they should be optimistic. This is a kind of problem that if people are willing to do what it takes, we see just about all of them improve. And we've got other tools here coming up. Okay, this isn't all of it. But many people put their dog in a crate because they see the dog pacing and getting frantic, and they think, okay, if I can hold this dog still, then she'll be calmer. Well, dogs need choices, and we tend to forget that. We love our dogs and cats like they were little people in furry suits, and that's good for all of us. But the reality is there's some very important differences in the social and structural well-being model that is genetically programmed into dogs. And one of those things is that, yes, they are denning creatures. In the wild, they seek out a snug little place. It's got a little low-hanging roof type thing, and they're safe in there. They can get out of the weather. They can be safe from another dog who might want to steal their food. It's got security associated with it, but they have the choice of entering or exiting whenever they feel the need. And if a dog needs choices more than any other time, it's when they're freaked out. So a den is a wonderful thing. If you use a wire crate, people should cover it with a sheet or a towel so that the sides and the top, everything but the door is covered. So it feels like a den, a nice fluffy pad in there, make it comfy, but the door should stay open. They need to have the option to leave or return. So what's going on neurochemically? Well, again, genetics is a common part of many of these things. The structural anatomy has been worked out in two breeds, as you can see, standard poodles and Irish soft-coated Wheaten Terriers. And classical conditioning from past storms, classical conditioning like Pavlovian conditioning. And these are dogs who, they've been through it before and it just worsens every time. So, empathy matters. And I tell that to people. I say, look, you know what? If you were not empathic, if you didn't care how others felt, regardless of their species, you wouldn't be a pet parent to start with. So we already know you have what it takes. And I tell people, look, you can do this. This is not as overwhelming as it appears. So talking to and petting a frightened dog actually works. And this is a departure from what we used to tell people, because we still know, it's still true, that anxiety, if a pet parent responds to it, comforts an anxious pet, then what gets rewarded gets repeated, and the dog believes that it would not have gotten that response from its person had it not been earned, had its person not wanted that behavior. Because that's the way canine leaders manage their subordinates in a group. Feral dogs, for example. The leader does not provide the great privilege of an interaction unless she sees behavior she wants repeated. So an anxious dog, people can actually cause more anxiety. But we're not talking about anxiety at this point. When the storm is approaching, there's anxiety. But when the pet is starting to freak out, that's fear. Now, one can lead to the other, but they're not the same thing. And fear, it turns out, is not something that can be reinforced inadvertently or otherwise. So if you've got a fearful dog, petting and talking to the dog can help. And we've got studies now that show that. But reprimands and punishment, and believe it or not, there are people who make that mistake. So I will tell people, look, here's why that is a mistake. So don't let anybody do that. And if there's somebody in your home who's prone to ridicule the dog or yell at it, just take the dog to another part of the house, because those things simply intensify the pet's response. They're already afraid. Let's not make that any worse. And some people believe that if they hold their pet closely and prevent it from running around frantically, that that will help. Well, it actually makes them worse, because again, it's taken away a choice. They need to manifest physically some of their behaviors that are going on in their brain. They need to run around. They need to run around. So they shouldn't be confined to a crate, and they shouldn't be restrained. A few dogs have gotten so frantic and fearful when being physically restrained that they become defensive aggressive toward their people, who in all other situations they trust and would never cross that line, but they're so freaked out. So it's an important thing sometimes, rather than wait until it's a problem, tell people, don't do that, okay? So preemptive methods really work. You know, thunderstorms, there's certain times of the year we expect them, but they don't happen every day except maybe for short stretches. And so we need to be prepared and put measures in place way ahead, okay? Separation anxiety, on the other hand, which we know is often coexisting with storm phobia, that is something that's predictable because it happens every time the pet parent goes to work. And so again, if you're going to figure out if that's the case, then we need to work with that as well, and any other anxiety or fear-related behaviors. And this device called the Calmer Canine, which you can see, it looks like a halo on this cute little golden retriever here. These things are totally safe. They provide no sensation. Pet doesn't even know it's wearing it. It's lightweight, and people can have the dog take its twice daily treatments, morning and evening, 15 minutes each. This thing shuts itself off. It's got a little vest I'll show you in a minute that's very comfy. Its fabric has Velcro. Anyway, they can have the pet wearing this thing for 15 minutes while folks have their breakfast. And again, in the evening while they're watching the news or something. The dog's just hanging out with them. It doesn't have to be restrained and held perfectly still. You don't let the dog run around and play frisbee while they're wearing it, because it would fall off. But they just have to stick near the owner. And these things can make a big difference. Now, here's a dog named Sufi. And you can read this. They live in Florida, which they're having some pretty serious storms these days there. And dogs showed very typical signs of storm phobia. And this dog responded very soon. The studies have shown that most of them take a 4 to 6 week, twice daily training course to improve noticeably. But there are a few like Sufi here who improve real quickly. And she found that she was able to distract Sufi by playing ball after just a few days, which she was onto something. And a lot of people figure this stuff out themselves. So here's Sufi. And I just wanted to show you a little video of her just being a cute dog, because we all love that, don't we? I mean, people who don't have pets, I don't think they have any concept of what they're missing. But here's Sufi wearing her Calmer Canine. And you can see that it's stuck to this little Velcro thing. Whoops, sorry about that. Behind her head, and it targets the amygdala, the fear center of the brain, which is at the back of the skull. But you can see she can walk around. You can see this thing wrapped around her chest and around her neck, and it's comfortable. She has no problem with it at all. So, yeah, we got other things we can do as well, and we should do. I mean, let's do everything we can for these pets to help them succeed and help them stay in their homes. Um, and I tell people, if you didn't have significant dose of kindness in your heart, that's another reason that you wouldn't be a pet parent. But you're already ready to do this thing. So here's what we can do. We can provide a special bed to these pets. When the storm is coming, out comes this wonderful comfy bed that the pet associates with being more secure. We've got an old association with seeing and feeling those storm clouds coming, and we want to supplant that. We want to replace that with something else. Rather than just avoid it, we're going to do that, and we're going to give the dog something else to associate with the approach of a storm. So that special bed. Now, many dogs can find their own place in the home where they're going to feel better. And I encourage people to let the dog figure that out. And a great place is very often a closet. It doesn't have to be a walk-in closet, but a closet ideally that has no exterior walls. And that way, when the door is partially open, the dog can go inside. There's lots of fabric in there because there are clothes hanging, and so that reduces the sound, it muffles the sound. And they get underneath the clothing that are hanging. And my closet has carpet in the bottom of it, which muffles even more sound and it makes it even more comfortable for my dog. And it feels like a den. And the door is only open partially, so they feel like nobody can see them. They feel comfortable in there. Now, if the storm is coming, or if one is predicted, and you are ready to withhold a meal, we're not going to starve our dog, but we're going to food motivate them. And then we're going to give them a food dispensing toy or puzzle that they can focus their brain on surviving by extracting the food. Now, this is a very powerful thing, and I encourage people to teach their dogs, at least some of the time, to extract their nutrition from a somewhat challenging food toy or puzzle. Dogs, by their nature, yeah, they're predators in the wild. They eat what they kill, but they don't get that lucky every day. And most of the time, they subsist on the mesa or wherever it is in the forest, wherever they're living. They get by finding carrion and eating dead stuff that might have been picked over by a couple of other dozen dogs. You give them a somewhat challenging food toy, and they've already learned how to do this, and they go, okay, I'm hungry, I'm a survivor, and darn it all, I'm going to extract the food out of this thing. And their brain switches into the appropriate mindset where a dog is genetically programmed to spend a substantial amount of their time every day, which is extracting food from challenging carcasses and surviving. So food toys, and this is just one of many. You can adjust this by screwing the halves closer together. You can put dry food or canned in it. There are lots of others. And the best food toy for a dog are the ones they use, the ones they like. Okay. Obedience training, reinforcing dogs for working for their person, great way to go. Relaxation exercises. T-Touch stands for Tellington Touch, was developed by a lady named Linda Tellington. She developed it for use in horses, and it's been adapted to other species, and you can Google it. This is just one technique here, and you can work with this by doing it as soon as the person hears the thunderclap, then they do this. And that can actually start counter conditioning the dog. And in fact, yes, you can start teaching desensitizing, diminishing the dog's sensitivity to these and counter conditioning when there aren't any storms, but people don't usually think of that. But this was a very recently published study in the Journal of Veterinary Behavior, and 70% of dog parents were doing this, where they would give a treat or play, and they figured it out themselves. Nobody told these folks this. They're just caring people who figured this out, and 70% of them found that they were amateurs. They didn't know anything different, and they did this, and 70% of them found that it improved their dog's response to thunderstorms on subsequent storms. So that's pretty powerful. The Sound Scary CD, which you can play in the other room and, low volume and feed the dog, do T-Touch or relaxation exercises, obedience, food toys, all that stuff while you teach the dog that, yeah, you can hear that in the other room, but we're not paying attention. That's desensitization to the sound. That worked in about 55% of the cases. Still pretty good. Pressure vests like the Thunder Shirt, not as good, but I think that it's still valuable when you add it in many cases. Some people say it didn't help. And then there's prescription medication, which is pretty impressive at 70%. You know, drugs can be helpful, and there are, of course, people who don't want to use drugs. And of course, the calmer canine is something that's pretty darn effective, about 80%, and without medication. In many of my cases, if they're pretty severe, I will do both because I want success. This first group of medications, the benzodiazepines, these include medications like Valium and Xanax. That's what diazepam and alprazolam are. These can be helpful, but they're not much good if the storm is already underway. They're going to be much more effective given prior to. The same with trazodone and clonidine. Can be helpful. Many veterinarians are happy to prescribe those things, but trazodone in particular, an hour or two ahead, and it can be hard to predict the storm. Cilio is relatively new, been around a few years now. It's a gel that is given by syringe, no needle, between the lower lip and the gum. And it is effective in just 20 minutes, and it's one of the unusual anti-anxiety treatments that can make a difference during the event itself. And so the veterinarian, it's a prescription medication. If a veterinarian doesn't have it on their pharmacy shelf, they can order it. All the veterinary medication distributors have it. It's very, very safe, and I use a great deal of it. And it can be quite helpful. And it is so safe that we can use it with any of these other medications. And again, we custom fit that to the individual dog. We do not sedate them. Acepromazine, you'll see on the right side of this screen, is an old-fashioned tranquilizer. And many veterinarians, some of the old-timers, people my age, still swear by it because the pet looks better. The pet looks sedate and resting, and they go, well, that's pretty good. It lasts several hours. Here's the problem. It has very little anti-anxiety benefits, and so what happens is the dog is so darn sedated that their brain is still highly anxious and agitated and panicked. They just can't physically manifest the problem. And you remember how important it is. If the dog needs to run around or whatever, you let him do it. Well, they can't do it with this, and in essence, they're in a chemical straitjacket. So acepromazine should be off the table for this. We use anti-anxiety medications, not sedatives, which is what this other stuff is. But pheromones like Adaptil, again, some people hope that by itself will help. It generally doesn't, but it can be a worthwhile add-on. Okay, and with cats, some cats have got this. I have two cats, and one of them has a problem with this. Lorazepam is a very safe benzodiazepine for cats. Again, preemptively is going to be best. Gabapentin is real nifty because you can open a 100 milligram capsule and put it on the food, and most cats will happily eat it. And it's very safe in cats. Prescription medication. Most veterinarians have that on the shelf. And cats can take Cilio, this gel I mentioned. It is not approved for use in cats, but we have experience with it in cats. We understand how it works, and we use just one dot. One syringe of the Cilio would have 12 doses for a cat, and it can be pretty darn helpful. So bottom line, yes, we can make a difference on these, and you should be optimistic in discussing it with pet parents, but also dig for other coexisting or comorbid behaviors